Welcome to A Balanced Life on the Go. I'm Dr. Nicole Lindsay, your host on this podcast, along with Dr. Brian Jeanette. This is a podcast designed to help connect you to a more balanced life on the go. Each week, we will bring you simple, concise, and easy to implement ideas, tips, and strategies to help you connect to better nutrition, movement, and thinking so you can achieve balance in your busy life. Isn't this what life is all about? Trying to achieve balance so that we can be healthy, happy, and live to our fullest potential. We're glad you joined us. Let's get started. Okay, welcome to Balanced Life on the Go. This episode is disc injury, disc health, and
the truth.
It is time to speak the truth about the disc. We're going to lay it all out here for you. We have so many patients that come in and they think they have a disc injury.
They'll come in and they'll say things like, I threw my back out, or I have a slipped disc.
Or my back just hurts and I think it's a muscle spasm when it turns out, in fact, it is a disc injury.
Listen, it's rarely ever a muscle spasm.
True. That's the truth. So we're going to shed some light on your discs and talk a little bit about what a disc herniation or bulge is all about, and the symptoms, the causes, and then what you can do about it, how you can fix that.
Absolutely.
Of course, let's talk about your socks first. We haven't seen what socks you're wearing.
I know. Well, I'm not wearing any special socks today. There's just some plain old Christmas gift from somebody last year.
Right on.
But I still try and wear them every once in a while.
Cool. You know, there's all kinds of pieces on that.
Show my appreciation.
They kind of look like the nucleus of the disc, so some of those. So I think it's appropriate.
Fitting. Yeah.
Very.
Yeah.
Okay, so let's start off with slip disc. Is there such a thing as a slip disc?
You know, really that term, I don't really know where that term came from. I think it's just such an easy term to say, and now that we, society-wise, we know what that means. Even though it's not very accurate, your disc doesn't really slip out of place, and it can't slip out of place. The disc itself is actually made up of cartilage, really, really tough cartilage that is connected to the bone on top and to the bone underneath it. And so that disc can't really slide out. Now, there are things that we'll talk about in future podcasts called spondylolisthesis or spondylolysis, where the actual bone can slip out or push forward or push back, but the disc really can't do that.
So there are some things that the disc can do. It can bulge when it's injured, it can protrude, it can herniate. But let's talk a little bit more about the anatomy so that makes sense.
Yeah.
So what you have in your spine are your vertebra, they're your bones. And in between the bones is going to be that cushion, which is the disc. And the disc is made up of this cartilaginous material. And that gives you the strength, the cushion, if you will. It gives you support, stability.
Shock absorbing factor. And now there's actually two parts of the disc. There's that tough outer part, and then there's that what you would call, I consider a jelly-filled center. And what this is, like Dr. Nicole was talking about, this disc is spread out evenly over the bone below it and the bone above it. And what that does is it helps to absorb shock and dissipate forces in the spine. So this outer part, it's concentric rings of cartilage that go one direction, and then the next layer goes the other direction. And they just sit back and forth, overlapping each other for several layers, and that creates this very, very strong structure. Now, through different things in life, and then we'll touch on these factors through weight, through occupation, genetics, smoking, poor movement quality, poor movement past sitting too much. Mm-hmm. That's the one thing. This outside layer that sits like this, it starts to get really, 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 really weak. And it gets so weak, in fact, that it can either tear, and when that tears, that causes so much inflammation, and that's where that really, really acute pain is. Or the disc material can actually start to herniate through, like Dr. Nicole was talking about, and that the material spreads, and then the disc actually pushes all the way through. And when that does, it just takes up space. It takes up space in your spine where there's no space to be had. Puts pressure on the spinal disc, puts pressure on the blood, on the arteries, the veins, the nerves.
Yeah, so when you're moving, when you're going throughout your life, throughout your day, as human beings, we're made to move. That nucleus, the very center of that disc, is made to be right in the middle. And as you pivot and bend and lift and twist, that's moving with you. So what happens when you injure the disc is you get a tear in that annular fiber, in the outer layer of that disc, just like Dr. Brian said. And then that nucleus, the center of that disc, like the jelly donut, pushes out and it tears through that disc. And this can happen in several stages. So it's not like it happens once and you're done with it and you fix that. There's certain stages, and the longer it goes, the more chronic it is. And if it's not untreated, it can progressively get worse with activity. So stage 1 is what we call the disc protrusion. And this is where you get a tear in the annular fiber, but the disc material itself is not outside of the disc yet.
It's really just kind of bulging at it or pushing and putting lots of pressure on it. And the body doesn't like this. When we have pressure in places that we shouldn't have pressure, think of gas in your stomach. Get that nice gas bubble after eating something that you probably shouldn't have eaten, causing that pain in that localized area. That's like what a disc protrusion type is.
The next stage, if that continues on and is not treated and you continue to put too much stress on that disc, then it turns into a prolapsed disc.
Mm-hmm. And those prolapsed discs actually look like this model. They're actually extending past that outer layer, and they're pushing out into the space or structures that they shouldn't be pushing out into.
The third stage, if that is not taken care of, is called a disc extrusion. And this becomes a little bit more complicated to manage. The other two stages are considered an incomplete herniation, where now we're turning into a complete herniation.
Mm-hmm. The fourth after that is actually worse. It's something called a sequestered disc. And that disc material, instead of bulging out, the disc extrusion kind of bulges out far and can drop either down, over to the side. It's going even farther. That sequestered disc actually breaks off. It is now floating somewhere in the spine and putting pressure on various parts in your spine, other spinal nerves, other blood vessels, other arteries that are down in there. And this can be really, really dangerous to your spine.
And painful.
Oh my gosh, and so painful. Mm-hmm. These are actually signs and symptoms of this are a 10 out of 10 pain one day, and then the next day you have absolutely no pain at all. And then you
think you're going crazy.
Yeah, you think you have no idea what's going on. Then you sneeze, or like you reach, forward to grab a pencil, and then bam, there it is again. That's because that disc material that's broken off is moving around, and they're incredibly
very dangerous,
hard
to manage, and oftentimes this requires surgery, unfortunately. So you can have disc herniations, and the symptoms vary depending on that. If you're listening to this and you think, maybe I have a disc injury, well, some of the symptoms are going to be, if it's a disc in your neck, in the cervical spine, it could be neck pain, and then you can feel some radiating pain into your shoulder and arm. You may even have some numbness and tingling that happens into certain fingers of your hand.
Mm-hmm. These follow very, very specific type patterns. So it's very important, if you think that you have this, to let your doctor know, or when you come in here and see us, to be treated by it if you think you have this, letting us know which finger or part of your hand that's affecting.
Yeah, exactly. So a herniated disc in the thoracic spine, that is going to give you pain, of course, in that thoracic spine, but then you can get pain radiating into your chest.
Mm-hmm. That wraps around. A lot of people come in, or a lot of people go to the emergency room thinking that they've had a heart attack because they're having chest pains, when in reality it's coming from the spine and the nerves that come out of the middle back, this thoracic back right here.
And then, of course, a herniated disc or bulging disc or disc injured in the lumbar spine can give you pain in the lumbar spine or no pain. You may just get radiculopathy into the leg. You know, we hear people say sciatica could be from a disc injury, and that can extend into your buttock, your thigh. It could just be in your foot. We've seen that many times.
Yeah, it's very weird. Sometimes, or I guess I should say often, they follow very predictable tight patterns, but most of the time when a disc herniates, it will herniate backwards and out to the side. And that's this very common type pattern with a disc herniation. That follows a very specific symptom, radiculopathy going down the legs. Sometimes they just herniate backwards or straight out the back. Sometimes they herniate forward. You're a special case if you herniate forward.
Yeah, that's rare. That's rare because the majority of them herniate back and to the side. We often see people present with this very awkward sideways posture when they come in, this antalgic lean. And that is very indicative of a disc injury when you notice, when you look in the mirror and your whole thorax and upper body is shifted almost over to another plane.
You're trying to run away from that pain because it hurts so bad on that side.
Exactly. So how do we get these disc injuries?
Like I said, like we talked about earlier, there's so many different causes and so many different risk factors for these type of injuries. The one thing that people think of is lifting heavy weights or weightlifting, when in reality, most of these injuries are not from people that lift very heavy weights. And we're talking upwards of like 30, 40, 50, 100 pounds, 150 pounds. Very rarely do we hurt ourselves doing that. And if we do hurt ourselves when lifting very heavy weights, it's just like that straw that broke the camel's back.
Yeah.
That last little tipping point that pushed your spine over the edge.
Yeah.
So excess weight, if we're overweight, you know, we have a huge...
Carrying 20 or 200 pounds overweight for years and years and years.
Obesity epidemic. What that does, your spine's just not meant to hold that weight. We all have like our, weight that you're born, you grow up, you become an adult, that like your weight is your weight. That's what you've always weighed. But when we weigh more, 10, 20, 30, sometimes even 5 pounds extra, but on average, most of our people in the United States carry 20 to 30 pounds extra weight. And we're just not meant to carry that much weight.
No, not at all. So that's definitely a way you can wear down the annular fibers of the disc and cause disc injury over the years. Also genetic. There's a genetic component to this oftentimes.
Yeah, up to 50% of your risk factors can be genetic. But as with genetics, we talk about, it's genetics, it's in my genes. My dad had it, my dad's dad had it, my grandma's mother's son-in-law had it. But when it comes to genetics, you can't change those. So let's work on things that we can change. We can reduce your other risk factors so your genetics doesn't play a role in this.
Right. You can strengthen your environment so that you can maybe slow down the progression or not allow that gene to turn on.
Absolutely.
There's lots of things there. So also there's a lot of sports that we see people have done as a younger individual, and now they're coming in as a young adult and they have disc injuries. And some of those injuries come from competitive dance or cheer, where they're
don't even get me started
jumping and landing in gravity very hard on the discs. They may be a base in competitive cheer, and they have people standing on them, and of course the discs are responsible for absorbing that shock, so doing that time after time after time after time, that can cause injury.
And that's directly correlated with core strength, weakness. Like we talked about, a lot of us have a sedentary lifestyle, and when we do that, we don't have a strong enough core to help stabilize and support that spine. So like these kids that are doing cheerleading, these kids that are doing gymnastics or dance, they're sitting for 8 hours in school, not having any physical activity, and then they're going straight into these high impact style sports and thinking that everything's going to be okay.
And they get injured, and then they go through another 5-10 years of their life with some back pain, and then they're picking up a piece of paper one day and boom, the disc, because their posture isn't
snaps and
correct and their muscles aren't strong.
Show me a teenager who has good posture.
I don't know very few. Well, we have some patients that are...
Yeah, we got some patients, yeah.
Okay, so let's talk about some good news. What can you do? Are you doomed to needing surgery if you have a disc herniation?
Absolutely not. Almost. Having to have surgery for a disc herniation is honestly very, very rare. And if you do choose to do the surgical option for a disc herniation, just know that the research is very, very specific on your outcomes with that. And so what they did was they take two groups, the surgical group and the group that does conservative care like chiropractic, and they followed them for an entire year of care with chiropractic, or an entire year after having spinal surgery. They were the exact same across the board, exact same pain level, exact same function. There was no increased benefit to doing surgery.
Interesting. So there you have it. So what can you do? Well, number one, you want to find the problem. Okay, you got to find the problem. Is it a disc injury? If so, what level of your spine is it at? We need specifics, right? What stage is it at? Is it a sequestered fragment already, or is it a complete herniation? Where's it at there? X-rays and MRI, all of this stuff we need to know so that we can help fix this. So you want to see a provider that manages disc injuries and disc health. So not all chiropractors do take care of disc injuries. They do adjustments, which is certainly part of the process, but there's a lot more that goes on involved with healing a disc injury.
Mm-hmm. Probably the major thing is actually creating a plan of care. You need a beginning, you need a middle, and you need an end. Without any one of those three stages, you're just going to fall into this cycle of, okay, I feel good. Oh, wait, 2 months later, I hurt my back again. And then a couple weeks, okay, I feel good. And then you hurt your back again. You just have, it's this roller coaster ride forever. And I know if you're listening to this right now that you know it's either happened to you or a close friend or family member that is dealing with recurrent back pain.
Right. So having a protocol, a plan of action to deal with the pain, to deal with the problem, to rehab the disc, and then to strengthen it later on. So some of the things that we can do for pain that we do in this office that you can do at home there's modalities. There's using ice in the beginning. Sometimes we'll alternate with heat. We can use e-stim or a TENS unit or a home TENS unit. Of course, there's anti-inflammatories, there's corticosteroid shots, and sometimes we have to go that route. We have to contact your MD, and we're all about collaborating with your medical doctor, with your orthopedist, with your neurologist. We will get on the phone with them and say, listen, the patient's not responding like they need to. We need your help. Can we get oral steroids? Can we talk about doing a corticosteroid shot to get the inflammation in a better state so that we can get more healing going? Of course, we want to avoid that if we can, but sometimes we need it.
Yeah, those other medical interventions can bring on other health issues that we have to worry about. So it's just very balanced type care plan between us and between your other medical providers. The other thing that we can do is a non-invasive low-level laser treatment, which I love the low-level laser treatments. It's going to penetrate deep down up to 5 inches into the body, and it's actually going to work on that cellular level to help reduce the pain and just to speed up that healing.
Flush out the inflammation. It's amazing. It's great for disc injuries and for other things. Mm-hmm. The third thing is decompression therapy. That is vital for you if you're dealing with a disc injury. And what the decompression does, it's a table that you lay on. We can work on a lumbar, thoracic, or cervical disc injury. If it's in the lumbar, there's a belt that wraps around your lower half and then another belt around your upper half, and it actually pulls you apart very gently. It doesn't hurt. You go through a pull pattern, and when that happens, there's a vacuum effect that's created within that disc space and allows the disc material that's bulging out to get sucked back into its rightful place. Very effective.
Right along with decompression therapy, the other things that we're going to do is we're going to find you what's called a centralization technique. Find you a directional preference. Help give you home exercises that you can do to help reduce those as well. There's no scientific data for this, but if every single doctor's office and every single spinal surgeon's office had a decompression machine, no one would be doing surgery. I'm so confident in the decompression machine helping disc injuries. It's wild.
We get fantastic results with it.
Yeah.
The other thing is the chiropractic adjustment. Of course, we have to deal with the problem, right? The problem that got you in this position in the first place. And that often means that your posture is abnormal. Your bones are out of alignment. So we have to couple the modalities to flush out the inflammation, decrease muscle spasms, break up trigger points, help manage the pain with the decompression, and then with posture alignment so that this doesn't happen again to you. So the adjustments are a vital part of that, and also getting the pressure off the nerves, removing those subluxations so that you can get out of pain and your body can heal.
Movement is life. Nothing in our body heals without movement.
Exactly. And then after we do this, the last step, which is part of the protocol in fixing this, is going to be the rehab, is the physical therapy, giving you specific stretches, specific exercises, things that we can do, that you can do to strengthen your core, to strengthen your alignment and your posture, so that over time you don't get these forces on that disc again and have this happen again.
I'm actually going to suggest and recommend that you actually do go to the gym and you do deadlifts, and that you do these movements that potentially used to hurt you or that did cause this pain. We have to continue doing that again. You cannot go your entire life by avoiding the movements that hurt you, because then, of course, 3 months, 4 months, 5 months, a year down the road, when you have to do that one movement again that hurt you, it's going to hurt you because you're not prepared for it. You're not strong enough to do it.
But this is something that you want to do after you've gotten to this point in our protocol, which will help you get there.
Yeah, absolutely.
So that's what you can do to help heal your disc and get back to doing all the things you want to do, and perhaps push yourself to go even beyond that and do things that you never thought you'd be doing before because you dealt with back pain or neck pain your whole entire life. There's certain hobbies and positions that when you're dealing with a disc injury that you want to keep in mind. Of course, like Dr. Brian said, we're going to help you overcome that. But in the beginning, if you're listening to this and you think you might be dealing with a disc injury and you haven't made an appointment yet, you want to make sure that when you're bending, lifting, and twisting, that you're using proper position.
Yeah, proper core strengthening, proper mechanics, because that's why it was injured in the first place. Improper mechanics, along with lots of other things that we already talked about.
So there you have it. This has been a long time in the making. We treat a lot of disc injuries in this office. We get really great results, and we've been wanting to do this and share this with you for a very long time. And I'm glad we finally made the time to do this.
Yeah, me too. The one thing that we wanted to share with you guys is that if you or anybody that you know is dealing with disc herniations or disc degeneration, and you've been told that you have to have surgery, that's your only option, I implore you to seek a second opinion. Come in here and let us take a look at it, or go see your local chiropractor that you live near, because surgery is an option for some people, but it's not an option for everybody.
Love it. And we have a disc injury and rehab protocol guide that we'd be glad to share with you if you live in a different state, or you're not quite ready to work on that will get you started. So you can follow us and ask us for that, and we'll be glad to pass it on. So I think that wraps up our disc talk today.
Heck yeah.
All right. Thanks for watching, everybody.
Thank you.